Okay, so for the sake of time, I think we've probably waited for people to get situated long enough. I'll go ahead and we'll get this meeting started. Thank you everybody for coming. I know it's a smaller group today, but that's the benefit of having it re-recorded by public access to be able to post it on our YouTube channel. So just a couple tidbits very quickly to update you all on. The next Western Marathon County meeting is going to be January 18th. They're still working on the location, but again, those will always be in our weekly updates, so you'll know where those are going to be held. But they are typically out in the rural communities out in Western Marathon County. As I mentioned, we do have our YouTube channel. On it, what's exciting for me is that at our Building Community Supportive of Recovery event, we were able to record our best practice examples from the recovery event. And so if you're interested, you can actually share that video as well. It's about 2 hours. We had a panel of people talking about STEP Industries, which is a transitional work site, the mooring programs, which is a comprehensive treatment program from everything from inpatient all the way through just peer support. We have Darjun, which is a community center that's for people in recovery, run by people in recovery, as well as Rise Together, who really help lead youth engagement and a lot of work in prevention in different school systems around the country. So definitely check out that video. You can share it. I know that there's a couple different agencies that are using that as part of an in-service type discussion. However you'd like to use it, please do so. Out of that came a number of different short-term action teams that we relaunched our stats, our short-term action teams. So yesterday we had our first recovery coaching action team. Tomorrow we have a sober living action team from 9 to 10 at Rasmussen College. So if people are interested in how do we get sober housing, safe and sober housing in our community, there's an opportunity for you. Next Friday from 9 to 10 at Mosinee High School, we will be having a youth engagement discussion of how do we engage our youth, how do we bring organizations like Rise together into the community, how do we support youth in their recovery efforts. And then in January, a small collective is going to go actually tour some of these facilities as an initial tour. So watch the updates in the future, because we are going to try to arrange additional tours to be able to go to places like STEP Industries and Darjun and mooring programs to really see how we can get those organizations within our confines of Marathon County. So all of those meetings we do try to make sure they're posted on our AODpartnership.org website. So as they show up, you might need to click in the details. What we found out yesterday when we had a meeting at Community Clubhouse is that Google Maps actually puts them somewhere else and not actually where they are. So if you do have any questions ever, we can't trust Google. If you have any questions ever on those meetings, you feel free to contact me or anybody else that's associated with AOD Partnership. We are in the midst of planning our annual Spotlight event, believe it or not. We do have this event every year in April. So we are working on setting the dates, right now we're looking at a Monday or Tuesday evening. So if anybody feels strongly on Monday or Tuesday, we're looking at the 10th or the 11th of April to host that event. As part of that event, we're going to be including our Spotlight Awards, which we do recognize 5 individuals or organizations in the community that are doing great work and helping us achieve our mission to reduce the burden of substance abuse, as well as we usually try to have some sort of educational component. So if you have any idea of what would be a great thing to have us include in this year's Spotlight, again, we're going to be actually doing a call out for community partners to help in the planning of it, because there's multiple components, including the awards, the presentation, as well as typically we do a silent auction, so we're going to be looking for donations for that, as well as some sponsorship opportunities for different organizations and businesses. So that'll be coming out soon. Before we get into partner updates, it's that time of year. We're very excited to be doing our elections this year for the AOD board. Just so if those of you that aren't aware, the AOD Partnership is a local nonprofit. We do have a board of directors. Our bylaws put us up to 15 individuals as part of it. So that includes 10 at-large positions, up to 10 at-large positions, and our 5 executive committee positions. So the officers that are actually ending, the terms that are ending this year include Brooke Davis, bless you, from DC Everest, Tracy Kujawa from Wausau Fire Department, John Dolan from People's Bank, and Laura Scuderi from North Central Healthcare. And then we did have one resignation that was accepted. from Julie Jensen from Social Services. So that actually opened up a number of different positions. So last year, compared to last year, we had a 75% turnover on our board, which was huge. This year we have a smaller recruitment pool, so there's a number of people that were interested, we just didn't have enough spaces available. So this year, the approved slate of officers by our AOD board members are Jody Behrens from Thrivent, Rachel Zemro from Behavioral Health Clinic, Joanne Janikowski, who was with, you might recognize that name from United Way, she's now with the American Society for Laser Medicine and Surgery, Faith Wilfley, who works with 5 Koshas, Dan Shine with North Central Healthcare, and then we have Jason Kepler, who's a current board member that's taking on the secretary position for 2 years, and Christy Keel, again, another current board member who's taking on our vice chair, which is a 3-year term. So this is our slate of officers. I know that we have 2 here. So I don't know if Dan or Rachel, if you guys would like to share why you have interest in being on the board. You don't have to. Okay, Rachel's good. Dan?
Thanks, Dan. You take this.
Well, just real briefly. I look forward to working with AOD Partnership because I believe that there's a really big connection between treatment and different types of treatment and prevention. And I think that the way it was something easy to believe in, especially with some of the work that Melissa has been doing lately with getting some of those community partners and seeing those models that do work in Wisconsin. So I'm really excited to see if we can cross some really interesting bridges together and move forward with our community. That's it.
That's it. And then we have Jason from SBIRT, who's right up front, taking on the secretary, and Christy Keel just wandered in the back, taking on the vice chair. So typically we don't do, first and seconds and votings. On the back of your agendas, for example, you have our notes, our minutes from the last meeting. But with this, it actually is part of our bylaws that this group, this slate of officers, is approved by members that are present. So I guess what I would ask is that members that are, AOD Partnership partners that are present, if I could get a first, a second, and then we'll just do a vote just to make it official. Nate Stetzer, first it.
Second.
Bob, thank you. Bob Wilcox, second. All of those in favor?
Aye.
Perfect. Thank you, everyone. Yay! Welcome, new board members. You have a lot of work to do. No, I'm just kidding. I'm kind of kidding. Okay, so that's excellent. We're really excited to have such a great pool of people that are interested in being part of this board. So as far as partner updates, there's 3 that are written. So I'm happy that I actually remembered everybody that was planning on speaking. I think what I'm going to do, I'm going to actually take it a little bit out of order. I'm going to start with, could I have you come up and share the Big Brothers Big Sisters? And I'm going to have our people come up here and talk, just because we have some microphones and stuff up here to make sure that everything is reflected. So just put that up there for you.
Okay, thank you.
I'll get out of the way.
Hi, I'm Ellen Grad. I'm from Big Brothers Big Sisters of Wausau. In October, we celebrated our 40th anniversary of serving the Wausau community. So as part of our platform for that, we decided to recruit 40 bigs, and we wanted to do it in 40 days. We're not quite there yet. We started in October, and it's December. We're not quite there yet, but we still need a few more to help us out. We're looking for either school-based, where you go in for a half hour, maybe during their lunch, and meet with them. Otherwise, we also have community-based, where you can meet with them longer term for an hour or 2 once a week. So that is basically what we are looking for to help fulfill the needs. We have about 50 kids still on our wait list that need to be matched with bigs. So if there's any way you can help out, we would certainly appreciate it. I'll leave some information right up here at the front table. Thank you.
Thank you. Thank you. Sorry, I started flipping on you. I was planning on having that. Yeah. If I could have you come up and talk about advanced pain management. Oh, we'll just let the announcements roll.
Good afternoon. Thank you for the invitation. My name is Lynn Hall. I work with Advanced Pain Management here in Wausau. I think we've been in the community for about 5 years, and there may be some misconceptions with some of the previous providers that we had. We have a new provider who's been with us for about 2 years. His name is Dr. Chris Ferguson. He's really fantastic, and essentially our goal, especially with the new CDC guidelines and the Wisconsin Medical Examiners Board guidelines that have just come out, our goal has been and will continue to be working with patients to be able to reduce their dependence, their need, their requirement, their whatever they think is going on for medication. So we have never been, in the past 2 years, the practice who's constantly, ramping up patients. We offer lots of different opportunities for patients to be able to work with us. Sometimes patients are not candidates for medication because they either fail a drug screen or something like that. We do pill counts, urine screens, opioid contracts. If they fail, they're not necessarily taken out of our practice. We still are available to be able to treat them with procedures or interventions. We just don't prescribe opioids for them. So we don't dispense opioids. We don't have any opioids on our premise. We only write prescriptions. People have to come in and pick up their prescriptions. There are no electronic prescriptions. Melissa was kind enough to bring a group through to tour last night. A lot of people were very pleasantly surprised about the location and how it's set up and what we have to offer. So I guess I'm throwing that out to anyone here as well. If you're interested in coming through for a tour, meeting with us, meeting the physicians, meeting the nurse practitioners that we have with us, you're more than welcome. We have our doors open to the community and have been and will continue to be very interested in working with, making sure that medications are where they're supposed to be and not where they're not. So, thanks.
And you guys, we did tentatively, right, schedule an open house
Yes,
in January.
Yep. January 24th, we are having another open house to the community as well as any business leaders. We've worked with the chamber in the past, and this will be the first time working through Melissa. So that is definitely going to be an option. It will be like from the 4 to 6 time frame or 5 to 7-ish. So you can watch for those bulletins. And again, more than welcome to come through and see what we're all about, meet our providers and our staff.
It was amazing, just saying. Because I do think one of the questions that Dr. Ferguson asked us was, what is your perception of pain clinics? And it was like, what's the first thing that comes to mind? And, I think a lot of us, if we ask that question, it would be, something negative, because historically pain clinics have had more of a negative connotation. So we're really excited that our local pain clinics are looking at alternatives to opioids, advanced pain management, bone and joint, and a number of others. So it's a very exciting time. So take them up on their offer. It's pretty fascinating. Okay, did you want to share the Give and Get Help Day?
Sure. And I'll actually talk while I walk since I know we're short on time here. So I have copies over by Hannah towards the door as you walk out. United Way's 211 publishes annually Give and Get Help Guide around the holidays. So there's 2 pages. One for ways that you can give help around the holidays, another for ways you can get help around the holidays. With getting help, feel free, as always, to encourage anyone in need of assistance, whether it be housing, food, information about counseling services available in the community, transportation issues, to call 211. With giving help, volunteering is, of course, an option, as is donating. A lot of the things on this sheet relate to gifts, food, but you can always donate, make monetary donations, and it doesn't have to be to any of the causes listed on here. Being at the AOD Partnership Meeting, the AOD Partnership is always an option for donations, as are any of the nonprofit AOD treatment providers. So, thank you.
Thanks. Okay, any other partner updates? Turn my head around. No. Okay. Well, we're gonna get right into our presentations here today. So who we have is a collection of experts. When I look at marijuana, we're really trying to look at it today through the lens of prevention, treatment, and enforcement. So we have representatives from each. Representing prevention, we have Chris Wardlow, who works in Outagamie County. What is the organization you work for technically?
I work for Catalpa Health, which is a behavioral health clinic for children and adolescents.
Thank you. Catalpa Health.
Catalpa. The tree. Catalpa the tree.
So Chris is going to share with us a little bit about the State Council on Alcohol and Drug Abuse, the SCAODA report called Marijuana in Wisconsin, which there are hard copies available here. You can also download it on the website. If you didn't pick up a postcard, it does have the link for the AOD calendar. We actually loaded up a number of different reports onto that calendar, including the SCAODA report, the HIDA report, which is a high-intensity drug trafficking area out of the Rocky Mountain region, so that includes Colorado, and I can't remember who else is included in that, but Colorado is for sure included. That's going to really break down the impact of marijuana legalization there, as well as there's a report that was put out by the National Institute of Drug Abuse, which actually is a great, simple, short, considering it's a governmental report, it's about 17 pages, report that really breaks down what is marijuana, what is the health impacts, what is the legalization impacts, and a variety of other things. So I do recommend that you check those out. So we have prevention with Chris, we have treatment with Chris, a different Chris. Chris Erdman from North Central Healthcare is going to talk a little bit about marijuana addiction and treatment. And then we have Officer Nate Stetzer from the Wausau Police Department that's going to talk about enforcement and share some of the things that have been learned around the country with legalization. And as you can see, he's got some goods in front of us. So I don't want to take up too much time, so if I could have Chris come up and we'll go ahead and get started with the SCAODA report. Easy peasy, just the bottom.
Mouse, are we
it's not turned
recording? I'll do the mouse then.
Okay, either way, otherwise you have this too. Whatever you'd like to do, Chris,
you.
it's all yours.
Okay, good afternoon, everyone. Thanks for inviting me to come in and speak. As I stated, I'm a prevention specialist. I'm housed over at Allegheny County. I'm employed by Catalpa Health, which is a fairly new, we're about 4 years old now, behavioral health clinic just for children and adolescents in the Fox Valley. And as a prevention specialist, I'm contracted over to Allegheny County to help coordinate the county's substance abuse prevention efforts. And as part of that, I have the privilege and the honor of sitting on the prevention committee of the State Council on Alcohol and Other Drug Abuse. And so Melissa asked that I'd give a little bit of background too, behind what SCAODA is and its charge, and then how we came to the point of deciding we needed to put a report together around marijuana, and then to dive into the report just briefly with my focus being more on the prevention side of things. So we are one of two councils, two councils, I meant to do that, I did that. Two councils within the governor's office. The other one is the Council on Mental Health. The State Council on Alcohol and Other Drug Abuse is really charged with providing information and advice to our elected state officials, as well as to people in the trenches doing the work of prevention. So you could see what the Act 14 states for SCAODA, but really to provide leadership, to provide insight and advice regarding pending legislation, and then to make public the problems and the current issues around substance abuse in the state. I think one of the reasons why we've put out reports is because the council meets, I think, quarterly. And so to be able to really provide some sound advice to the legislature when a bill is pending around substance use, it's kind of hard to do when you're meeting so infrequently. So I think that's one of the reasons why we put these reports together, so that when a bill is pending or when a bill does get introduced, we can direct the legislators' attention to these reports, and we can also disseminate these reports out to folks like yourselves, to coalition people, local leaders, who could then use the information in the report to educate their local policymakers. And I think, as you know, I think we convened as a committee in 2014, October of 2014. At that time, around that time, we did have legislation that was introduced by Representative Sargent, who introduced legislation to legalize marijuana. So it was timely in that sense. SCAODA also consists of about, I think, 4 committees. Like I stated, I sit on the prevention committee. There's a treatment recovery committee, I believe harm reduction, a funding committee. So what we do as a prevention committee is when we identify a priority that's sort of lurking out there, or an issue that's lurking out there that needs some attention, we propose to the full SCAODA that they convene a work group to study that issue and to make recommendations. And so we really don't operate as an ad hoc committee on a particular issue unless SCAODA says, yes, we approve and we feel, and here's your charge. So it comes top down. And again, our purpose as a prevention committee of SCAODA is to support prevention and reduction of alcohol, tobacco, and other drug use and abuse through evidence-based practice with a special emphasis on underage use. And that's important to kind of keep in mind as we move along here. So how did we come to an ad hoc committee to look at marijuana? Well, it really grew out of a number of things, but primarily 2 previous reports that came out of SCAODA. And both of these reports can be downloaded from the SCAODA website. But one dealt with prescription drug abuse, the issue of prescription drug abuse, and then the other one dealt with heroin. And as both of those work groups tackled those issues, it became very clear that for the most part, people who found themselves struggling with prescription drugs or found themselves struggling with heroin didn't start with those drugs. That the majority of those folks had a prior history with other substances during adolescence, primarily early adolescence, and more often than not, marijuana was part of that. So it became very clear that we needed to begin to think about marijuana and try to be proactive. And, you know, we had this stuff going on as well. The national approval for legalization continues to go up. I think right there at the bottom you can see just last October, the Gallup's most current poll showed that for the first time 60% of adults favored legalization. And it really crosses, you know, all ideologies as well. So while it tends to be more of a liberal issue, you can see where there's a sizable number of independents and Republicans that favor legalization as well. We've also seen the landscape around this issue continue to change, and it changed even more in November as we had, I believe, 4 states legalize recreational use. And then I'm not sure if Arizona actually made a decision. It could be 5 states. I kind of lost interest after the election. But at least 4, and then 4 states came on board and legalized medical use. So again, the changing landscape certainly is influencing public opinion. Locally, it's certainly influencing opinion among local people, or among local youth. So we wanted to, again, try to get out in front of this. So here was our charge. SCAODA said, yeah, you're right, we need to begin to look at marijuana because it is playing a significant role. And so this is what we were charged with. To research, evaluate, and develop recommendations that best serve the public health and safety of all Wisconsin residents, and to really look at the issue objectively, which was hard to do, but as objective as we could, and come to a place of offering recommendations based on evidence, based on research, based on what we were finding. And we did study as much as we could what was happening at that time in states like Colorado and Washington. We wanted to know how this was impacting them. So we convened in October of 2014 When SCAODA convenes a work group, you have 12 months to do your work. At the end of 12 months, you have to submit a report. Okay? So that was our time frame. Here is a roster of our ad hoc committee members. This was a tremendous group to work with. We had experts, I believe experts, spanning all aspects of this issue, from law enforcement to criminal justice, to treatment and recovery, to prevention, to social services. And then we had a couple of doctors, research psychologist Krista Lisdahl, who is nationally renowned for her work on studying the impact of marijuana on the developing brain. She's right here out of UW Milwaukee. And then we had Dr. David Galbas-Riche, who is a member of the American Society for Addiction Medicine, and he manages a clinic hospital down in the southern part of the state. I apologize, I can't remember. So we had those experts at the table as well. And then we had our team of state prevention people providing us with support and keeping us focused. They were herding cats most of the time. We also had the opportunity to tap other resources when we had questions to ask. So this is just a list of other folks that we reached out to. That bottom one, Bill Persinger, really shared with us information on how marijuana impacts the workforce and issues like workforce safety. So we were very fortunate to have him share his knowledge with us. So 12 months was our time frame. We probably, the first 4 or 5 meetings, we spent those meetings focused on learning. We'd have experts, subject matter experts, share their knowledge with us about different aspects of this issue. So Special Agent Brad Dunlap talked about the law enforcement side of things. We had Dr. Lisdahl talk about the neuroscience and how it impacts the developing brain. Dr. Galbas-Riche talked about addiction and how this impacts addiction, how this is related to addiction. We had a team of prevention people share their information about best practices regarding prevention, and I'm sure I'm missing some. But again, those early meetings was just to gain knowledge. And then once we felt like we were in a place to sort of divide and conquer, we identified 4 work groups to continue to further research, study, and really come to developing recommendations. That first bullet point is what started as medical marijuana. But the people that were in this work group insisted that they did not want to call any work group medical marijuana because there is no such thing. Okay? They wanted to call it by what they felt was what it was, and that's cannabinoid research. So they studied all of the research that's being done on the medicinal and therapeutic value of cannabinoids as medicine. So it's semantics, but they felt very strongly about that. So we let them go with it. The legalities and regulations group, they're the ones that tackled the recommendations around decriminalization, lifting prohibition, things like that. I worked with the prevention committee. We had probably the easiest task. And then we had a treatment and recovery committee that looked at cannabis use disorders, what that looked like, and what treatment modalities showed evidence in reducing those disorders. You guys all will have a copy of the report, we'll get it. But I just wanted to show this. I wanted to point out that I think the real value in this report is what's in the appendices. There's a wealth of information in there. Anybody that's looking to learn more about this topic on a number of different fronts, I would urge you to go to the appendices and use that, because that's a great place to start. And if you can't find what you're after there, it'll refer you to resources that you can get more information on. But I think, you know, given so much of the information we're seeing out in popular media, so much of what kids are hearing, so much of what parents are believing based on their own personal experiences 20 years ago. I know in talking with prevention people, teachers, physicians, anybody that interfaces with these folks, there was a cry for information. People wanted knowledge. They wanted talking points, things that they could share. So I think that's, to me, that's been, since this report's been published, one of the main tools that I've used. And again, from a prevention standpoint, what was it that we wanted to target and focus on? It became very clear from the work Dr. Lisdahl and her colleagues in neuroscience are doing that we had to focus on preventing the early onset of marijuana use among young people, just because of the information that you see right there in front of you. And it was pretty overwhelming. And actually, you know, I'm kind of a research geek. Not that I read research, you know, first to last page, but I like to skim the abstracts. But if you go on to Google Scholar and you type in cannabis in adolescence and just limit your research, your search to 2016, you'll see that there continues to be a priority on better understanding the impact, the true impact that cannabis has on the developing brain. We also, as prevention people, now I'll focus on just the prevention aspect here, we wanted to make sure that we highlighted the evidence-informed risk and protective factors around cannabis use, influencing the onset of cannabis use. And again, this is a lot of information. The beauty is it's right there in this report, so you can take it with you. But in evidence-based prevention, we target identified risk and protective factors, especially, most importantly, those that are prevalent within a specific group that has identified a need, and then having identified risk and protective factors, we're able to then adopt evidence-based prevention strategies to address these. So these are the risk and protective factors that SAMHSA has published. Again, you have those in your report. In our recommendations too, we were really adamant about encouraging school districts to continue to survey their kids. We need that data. Any of us that are doing prevention work or early intervention work, we need that data in order to make informed decisions. So we need to continue to collaborate and partner with schools. And really, from a prevention standpoint, there's nothing really earth-shattering or revolutionary here. This is prevention, as we do prevention really for any substance. We got kind of bogged down for a while. People are like, well, we need to identify those evidence-based prevention strategies that were developed to address marijuana. Well, no, we don't. There aren't any. These evidence-based prevention strategies have measurable outcomes in reducing marijuana use, but they also impact a number of other substances as well. And that's really kind of our message in the prevention section, is that we really have to just expand the narrative and include marijuana in the conversations that we're having in these programs with kids, because there's still a common set of risk factors, a common set of protective factors that influence all these drugs. So if we're doing underage drinking prevention, to some degree, depending on what it is, we're also doing marijuana prevention, and vice versa, okay, if we are addressing some of the common risk and protective factors. The same was true in the treatment end. You know, people wanted a treatment modality, an evidence-based treatment modality that was developed just for marijuana. And I think we might have found one or two that had some evidence, but really, when you looked at the evidence around the most commonly used best practices, they all had evidence of impacting marijuana use. And so that was a point we made in that section as well. Coalitions. We reinforced the point that was made in the other reports, that the best way to attack this, you know, is exactly what you're doing right here, through coalition work, bringing together community partners to address the issue. So we called for continued support for community coalitions. We looked at, you know, comprehensive prevention strategies that address the issue from a number of fronts, to help create an environment really that supported young people and families in not using marijuana. For workers, for employers, there is a document out there, and you can access it. It's free to download at the American Association of Occupational Health Nurses and the American College of Occupational and Environmental Medicine. They've developed the marijuana in the workplace, and it's a lengthy article with some strong recommendations for employers on how to address this issue. Both if you're in a state where it's legal, either for medicinal or recreational purposes, and also in states where it's not legal yet. Okay, they make recommendations. We strongly urge broad support for training law enforcement, providing law enforcement with the tools that they need and want to better identify drug-impaired folks. So these recommendations are in there. And then for our healthcare providers, family providers, pediatricians, anybody in healthcare, we strongly urge the use of SBIRT. Even within schools, in a earlier section, you know, this screening, brief intervention, and referral to treatment to identify these problems early on and to get kids connected to evidence-based help. And so that's it. Did I come in under 20?
Right at it.
Oh, I rehearsed. All right,
So I think we'll wait for any questions until the end. So with that, Chris, could I have Chris number 2? This presentation will be loaded onto the website, as well as Nate's presentation and any other materials, you know, from today. So, and you
I'm just
don't
using this, so.
old school. That's all right. I think what I'll do is I'll just leave this up.
Can you grab my pen?
Yes.
Good afternoon, everybody. If you have a hard time hearing me, let me know, please. Since I got hearing aids, I haven't really come to terms with the audio version of how loud my voice is. 235 pounds and I talk like a squirrel. I can't figure that out. I wanted to start out by, Dan and I were talking, and with what's been in the news lately, and one of the struggles as a provider, incidentally, clinical substance abuse counselor at Lakeside Recovery, the 21-day MMT program at North Central Healthcare. But one of the struggles that I've had, and I think other providers have had, is how do I get across the absolute seriousness and the power of addiction. And in talking, an example that I began using was, do we have any dog owners here? What? Anybody over the top, kind of, with dogs? Yeah, Dan, I figured. Your two dogs, or two dogs that are like yours, are at the park and they're tied to a tree. You're sitting at the park admiring them, wanting to go over there. Somebody comes up to you and says, sir, I just wanted you to know that in the last 2 weeks, those two dogs have attacked and killed 5 people. Would you go?
No.
mindset of an addict. Northwest side of town, heroin's killed 5 people in the last 2 weeks. What do they want to do? I got to get me some of that stuff. It was just something, Dan and I were talking, and it kind of just really hit home when we were talking about that. In regards to marijuana, I just shake my head. I was going through the internet, and there was a website, I think, that was developed by police officers in terms of street names. And it took me my whole lunch period to go through all the names of used on the street by marijuana. In terms of why is it difficult to treat people that are addicted to marijuana is, I think, number one, it's so glorified. It's become such a part of their life. I wake up, have a cup of coffee, I smoke. Have lunch, sandwich, Pepsi, I smoke. When they come into treatment, I think they put that at the back of their head because they're there for, no, I'm here for heroin, I'm here for meth, I'm here for alcohol. And you can just see during the course of treatment, it's just sitting back there and continually has to be addressed and addressed. I've been in a group before where there's half a dozen clients, and I'm a target of why it should be legalized. And it goes on, and I just kind of, sit back until my last response is, bottom line, it's mind altering and mood altering. Can you be in recovery? If I'm a heroin addict and I'm not using heroin anymore, can I say that I'm in recovery? My opinion, the answer is no. I can say I'm no longer using my drug of choice. But for a lot of the addicts I work with, it's their final vice. They're digging in. They don't want to give that up. Other arguments, natural, comes from the earth. My response is, so does poison ivy, but I don't see you smoking that. And it's legal in some states. It's an herb. And that really makes it difficult. They minimize, it's so sensationalized in terms of, even when you look, I don't hear a ton of stuff on the news about people dying from marijuana. You don't read about it. So it just, they come in with that minimization of what marijuana does. In terms of mental health issues and the effects, specifically it has on adolescents, there was a study done on 1,000 adolescents who began using marijuana about the age of 13. And between 13 and age 38, your IQ stays about the same or goes up. And research found that marijuana addicts, that the averages was that their IQ dropped on average by 6 points. And the thing that surprised me is once they stopped, didn't necessarily go back up. So that's one health effect. THC users 4 times more likely to develop depression. Incidentally, from the IQ, the authors concluded that marijuana is a neurotoxin to the brain. Again, 4 times more likely to develop depression. Another study, 1,600 students, age 14 and 15, 60% had used by age 20. 7% were daily. Young women who are using daily were 5 times more likely to suffer from depression. Information comes from NIDA, NIDA for Teens and addiction.com. Marijuana triples the chance of developing psychotic symptoms. 3-year study, again, following about 4,000 people who have never experienced any psychotic issues, found that they were 3 times more likely to develop psychotic symptoms, which included bipolar depression, manic depression. some of the other effects, and this was another thing that I found that made it more difficult of convincing, or not convincing, providing information to teens and to the clients, is that when I was looking for long-term effects, vague. You know, I don't read it, and you know, with heroin and meth and coke, you know, you read in death. You know, you don't see it with marijuana. One of the things I did see was that men are at risk for developing testicular cancer. Women that are pregnant, there's research that they can secrete marijuana in breast milk. And that's something, there's an ongoing study yet with that. Chronic bronchitis. Now, if I'm a marijuana smoker and I read chronic bronchitis, what's that going to mean to me? And it may increase the likelihood of responding to infections. Again, that's real vague. You know, what does that mean? Other things it can do can cause sleep problems, impaired learning, and I'll get to that in a second. Obviously, increased the risk or chance of developing another addiction. Although, and this was a surprise to me, the majority of marijuana smokers don't move to a harder drug, and that really was surprising me. It goes back to the whole gateway drug scenario. My opinion, and I've had discussions with this about gateway drug, I can remember as a kid smoking my mom's cigarettes, Pall Mall non-filters, mistake. But I remember feeling like a rebel. It's at-risk behavior, could have gotten in trouble for it. And I got bored, and my thought was, what's next? So the fact that somebody can say this specific drug is a gateway drug, I don't know. You know, I think it has to do more with my interpretation of what that did for me. Not necessarily the high or whatever, but what did it do? It made me feel more, you know, more important, more like a rebel, certainly more important to my friends. But I got bored with it. Does marijuana have withdrawal? The answer is yes. I don't know if most of you have probably heard of Father Martin's Chalk Talk. There's a part 2. I can't think of the gentleman's name. He's a PhD, Caldwell something or other. Talked about the withdrawal symptoms, physical, with marijuana. The one that I take notice was increased sweating, but on the forehead and the palm, and that there's a metallic-y smell to it. Other physical, stomach pain, I said sweatiness, shakiness, fever, chills, headache. I've worked with people, increased anxiety. Some of the mental withdrawal would be irritability, like anxious and worried, depressed, restless, again, trouble sleeping, and low appetite or loss of weight. They put some research on the effects of marijuana 7 hours to 20 hours out. And what they found was, obviously there remains an attention to detail, concentration, impairment, making decisions, increased impulsivity, problems with what they call working memory, and verbal fluency. Still kind of having a hard time coming up with certain words. Withdrawal symptoms peak at about 48 to 72 hours and can last 2 to 3 weeks. And I've read a couple different reports, 33% to 78% resume because of the withdrawal. So what do I do? What do we do when we're in treatment? A couple of different therapies that work. cognitive behavioral therapy, basically teaching behavioral and cognitive skills to cope with the triggers, better understand how the triggers thoughts and behaviors, how they're linked. The other one is one of the others, contingency therapy, which I've never used. It's basically a reward system. I'm going to assume it might be done more in long-term treatment, possibly criminal justice treatment, where there are privileges and you can earn certain things, but you're given reward system based on either what you're doing or what you're not doing. And then the last one was, and the one that we use and I use most often, is motivational enhancement. It's not my job to convince that person that they have a problem. Wouldn't do them any good, nor me any good. What I can do is help them. I can guide them, discuss things. One of the tools that I use frequently is looking for discrepancies. Marijuana is okay to use, it's natural. Yet, if I want to get a job, I've got to alter my urine. You know, there's some discrepancies there with their values and with their morals, and I found that they just sort of walk themselves into it. If the longer you let them go, they're going to eventually you're going to find discrepancies. So I learned a lot of information that I hadn't known. I also learned that I think I got to turn up the volume a little bit in treatment about marijuana. When I'm doing assessments, again, meth, cocaine, heroin, alcohol, and I think they come into treatment only with that in mind. I have to really push. Is there anything else I can think of? Do you use marijuana? Yeah, okay. And then it goes on from there. But I found even after that discussion is sort of done. And so it has to be brought up more, I think not only in our treatment, which we've talked about, but also elsewhere. So it's the information that I have for you.
Nate, you're up. Didn't break anything today, did you?
Still the smash pipe from last night.
Oh, good.
All right, so I'm going to start off by saying this.
You gonna stay up here?
I walk
Yes.
around a lot.
Don't walk around too much.
Okay,
Just want to make sure you're recorded.
I can do that. All right, so I'm going to start off by saying this, that I guess when I was constructing this PowerPoint, one of the first things I thought about was the title, obviously, because you have to put a title on your PowerPoint. But I thought about the legalization of marijuana. And the reason why I put it on here is because if I had a quarter for every time somebody told me that marijuana was going to be legal, I would probably be vacationing right now in Florida. And I wouldn't need to work because I've heard it so much. And so the aspect that I'm going to bring to you is my angle from law enforcement and the experiences that I've seen as a police officer. I work in a pseudo-drug unit. Half of my work is done in prevention and community outreach. The other half is done working drug investigations and so on. So, all right. Some of the things I'm going to talk about, and I think one of the things that we really have to stress is that marijuana is still controlled by the Controlled Substances Act. So some of these states that have passed some of these laws, whether it's recreational or medical, are technically in violation of some of the federal policies that are out there. We could get into a whole bunch of different stuff about conversations about that. I'm pretty sure you've seen it in the news, so we don't have to go into it too much, but that's just something to keep in the back of your mind. So currently, in the United States, there's approximately 28 states that have legalized some form, whether it's medical or recreational. And I'm not going to get too much into the PowerPoint. I mean, there's a lot of statistics that we could go over, and to be honest with you, as a cop, I've never really enjoyed statistics, but I feel like it's necessary in some of this. So one of the experiences I have and data to back that up is that I had the opportunity to do a lot of interviews while I'm talking to people who've been using a whole different type of drug, but a lot of it starts with marijuana. I experimented with marijuana when I was 11, 12, 13 years old, and it kind of continued. I used that, got used to that, and again, I might have got bored, or I might have tried something else, or been willing to try something else, and they might start using other drugs. So some of the data suggests that more than half of the illicit drug users begin with marijuana. These are just some examples from search warrants that I've done personally where we found marijuana, and a lot of people say, well, marijuana is really not a big deal, and it's kind of what some society or some communities have taken the effect of, marijuana is really not that big of a deal, or society has kind of looked at it as, well, it's starting to become accepted, or it may become legal, so it's okay. But some of the scary parts with marijuana is that this is one search warrant, for example, where it may look like a little bit of marijuana. So if you see there's a clear and green bag there, it is. It's a little bit of marijuana from the eyes of law enforcement. But one of the things I want to draw your attention to in this picture is that if you look in some of the clear bags, there's some shards of methamphetamine, and that's a pretty significant amount of methamphetamine. But again, this person said, I started with marijuana. I started when I was 11 years old, and it just kind of increased, and I kept using other drugs while I was using marijuana as well. This next one, so this one was actually from a controlled purchase of marijuana. This is what we call a fourth or half ounce. What we do with this is this goes into evidence, obviously, but this is kind of what we see commonly. We can purchase this. It's pretty easy to get your hands on, and it's pretty generally accepted. This is the scary part, is that this is all too common. This was actually a federal search warrant. This was done works with DCI and SIU, so the Department of Criminal Investigations and the Special Investigations Unit. These are 1 pound bags. So these on the street are anywhere from $3,500 to $4,500 each pound. So as you look at this, there's a pretty significant financial amount involved in this as well. And this was not the only amount that we found. There was several suitcases full of marijuana like this. So this just kind of puts in reality that there is a lot of a talk or conversation that needs to go on because it is in our area and it's pretty prevalent. So there's a lot of arguments about why marijuana should be legal, and I guess one of the things that I'm going to focus on is the legalization in Colorado. I've had the opportunity to listen to I think he was an agent out of Colorado, speak about the issues they've been having as far as law enforcement goes in Colorado. And one of the first things he said was, there's a lot of discussion out there, there's a lot of different opinions, and he gives these talks all over the country. And usually he gives these about how law enforcement is struggling to deal with some of these problems. So some of the arguments have been to eliminate arrest for possession and sale, resulting in people having less criminal records and reducing national prison populations. And I'm just going to go through these quick, and then we'll go to the adverse here in a second. But free up law enforcement services, reduce traffic fatalities, increase or decrease the use among youth, add revenue by taxation, and eliminate the black market. So one of the things that I focused on was the HIDA, or the Rocky Mountain HIDA, which is a high-intensity drug trafficking area. They did a report, it was a 160-page report, I believe it was, discussing what we're discussing right now. So there's been a 48% increase in marijuana-related traffic deaths from 2013 to 2015, and this is when Colorado really started getting into legalizing both recreational and medical marijuana. And then the scary part that kind of freaks me out is that marijuana use among youth, they were ranked number 4 in 2011 and 2012, and this is the whole state of Colorado. But then once it got legalized, then they actually became number 1. And what that means to me is that more people are using, and it's more commonly accepted that it is okay to use marijuana. Hospitals as well have seen an increase in the amount of people coming with marijuana-related issues, whether it's they're hallucinating or whatever the reason is for the emergency room visit, but there has been an increase in the amount of people visiting because of marijuana use. The other thing, and we struggle with this frequently in our area, is that the postal services also have inspectors, and they also search for things such as marijuana being shipped to different agencies or different places. And so they've seen a giant increase in the amount of packages being seized because marijuana is being shipped to other places. So if you can imagine you have legal access to marijuana in a certain state and you know that it may not be legal in another state. So if you have legal access to that, you ship that out, you're making money on it even though you have legal access to that marijuana. Just one interesting fact here, and I didn't put this in the PowerPoint, but I find this really interesting, is that Colorado is actually being sued by surrounding states because of the issues that have been seen around marijuana. Because their marijuana is being shipped out to other states, and those states are pretty upset with that going on. So the other thing with marijuana use and the legalization in Colorado is that, so in Colorado, there are 424 retail marijuana stores in Colorado compared to 322 Starbucks and 202 McDonald's. That's crazy. That's just insane. So you could go to Colorado and find marijuana easier than it would be to go to Starbucks or McDonald's. Also, with that being said, there's also 68 jurisdictions who have outlawed or have banned medical and recreational marijuana businesses. And that's businesses. It's not necessarily banned marijuana use or medical use, but it's just the stores themselves. One of the other things that this presenter I went to a couple months ago said, going back. Dang it, I gave away my surprise. One of the things that he said is that there's a lot of businesses that are complaining, and specifically in Denver, where they have conference centers and convention centers where people don't want to go there, or they won't attend their conferences because they may be afraid that they're going to see a higher crime rate, or they're going to have more issues that surround marijuana. One of the things, and to be honest with you, I don't have all the statistics on Colorado, but what I can say is that one of the main ideas behind the legalization of marijuana is that they were going to get money, or the state would get money for the tax on marijuana. And it's been just the opposite. They've gotten a very small percentage, so it's actually 0.5% of all the sales of marijuana actually goes to the state. So really they're seeing the mere opposite, is they're not getting tax revenue from the marijuana sales, but yet the market in Colorado is just booming. One of the things, if we go back, I don't know if I can figure it out here. So one of the things with this is all of these arguments have been, we're going to eliminate arrest for possession, we're going to free up law enforcement services, when really it's done just the mere opposite. So law enforcement services have been more tied up because it may be leading to other drug use, such as heroin or methamphetamine. Not only that, you legalize marijuana and you tell somebody they're allowed to have 6 plants, for example, and they're growing 30, and they say they're growing for other friends or they're growing for somebody else. The struggle with that is, how does law enforcement manage that? How does law enforcement have the resources to go and manage, okay, this person's growing for somebody else, this person legally has this plant, so they're seeing a lot of issues with that. They're actually seeing an increase in traffic fatalities. They're seeing an increase in the use among youth. Again, they're not making a whole lot of money on taxation, and it has created another black market because now it's being shipped from states which are legal to states which are illegal. So to kind of bring it all home, and time-wise, I want to get to the fun part, the show and tell part. So I flew through this, but obviously there's a lot of information that's going on this, and specifically in Colorado. So if you do have an interest on that, the HIDA report is attached to the AOD website, so I would check that out. And then also, if you have any other questions, you can talk to me after this too. As I said before, there's a lot of financial gain in some of the marijuana markets here locally. These examples are from search warrants that I've done personally, but this is just an example of marijuana that's available. You can call up somebody and say, hey, I want a little bit of marijuana, can you hook me up? And these are types of things that are going on, and people are actually making quite a bit of money off some of these sales. This is also another common thing that we see. These are some pretty substantial amounts of cash, some pretty large amounts of marijuana, and then also firearms are associated with it. So you talk about the sales and the use of marijuana, it is often associated with some violence of it. So you have firearms, you're talking about dealers ripping off other dealers or users ripping off dealers. It's present. I don't want to say it's really common, but it is present in this area. I have seen it where marijuana has been shipped in from Colorado. I had somebody tell me a couple weeks ago that they have a legal possession of plants in Colorado, which once you take it from Colorado and bring it to Wisconsin, it is not legal. I've taken calls where people have had legal possession in a different state, Specifically, this one was from Michigan, where they had a card in Michigan that they were able to use marijuana. They came to Wisconsin and believed it was okay to use because they had a card, which that's not necessarily true. So what we're also seeing is you can actually buy these online, or you can have them in Colorado, is edibles. The scary part for me is that if you look at these gummy bears here on the left, they look like gummy bears. When you open them up, and I've smelled them myself, they smell like marijuana, and if you smell marijuana before, you'll definitely know what I'm talking about. But a kid or somebody who doesn't know about it may open one up and have one, and if you're eating that whole bag, there's going to be some pretty serious consequences for that. Brownies, and we've all seen the jokes, we've all seen it on TV, but this is also prevalent in our area as well, and we see this also. So this is kind of a joke. If you take a quick glance at it, don't read too much into it, but this was a search warrant we did. This was several controlled buys into a specific person for marijuana. When we tried to serve that search warrant, everybody ran from the living room of the house to the back of the house, and this is where we found all the marijuana. So the toilet was still running when we got in there, and unfortunately we had to scoop all of it out and dry it out and weigh it out and stuff like that. But so these are just some examples. You know, people know that it's illegal and that you can't possess it here, and so there are some ways to try to hide that too. With that also being said, we've seen some pretty interesting ways that people have used marijuana. This is one original one. This is actually a carrot that somebody used as a smoking pipe. So those are just some of the things that we've seen in law enforcement. What I did is there's a lot of different creative ways that we see out on the street to try to hide it from us. Everybody has that argument of, I know marijuana is illegal, but yet I feel like it should be, or it's going to be eventually, so that kind of the catch is to hide it from us. So I have some stuff up here. I'm not going to pass around just for time's sake, but if you want to come up and check it out here in a minute, you can. I do apologize. Last time, actually I think it was 2 times ago, Melissa and I did a presentation, I accidentally smashed our bong, so this is semi what it looks like, but unbroken. That's what it's supposed to look like, so.
That's, well, we've got about 5 minutes. Does anybody have any questions for any of our presenters? Going once? Okay, so I think what we'll do is if anybody wants to come up and see some of Nate's wares, including some of the concealment devices, if you've never smelled marijuana before, you have it's not really marijuana, it's like a little sample thing that they can show. But definitely come up and check out some of this stuff. Make sure you fill out your evaluations. Make sure if you want CEUs, you fill out those forms and return them back to the end. There's a number of different materials over there. Download the different reports and things that we've talked about here today. They all are on our AOD website right in the calendar option. And there's handouts for the Give and Get Help Guide over there as well. And information on advanced pain management and the Dr. Ferguson on the end. So thank you everybody. Safe travels. Have a wonderful afternoon.